Joining us once again is Washington State Governor Jay Inslee, who is in the middle of helming the response to the largest outbreak of coronavirus in the country thus far. Sir, thanks again. Before the break, you mentioned that I had said that there was 160 plus confirmed cases in your state. And you said that the way you're thinking about it, you and other officials are thinking about it, is that you're thinking that there may be as many as 1,000 cases in the state. Is that what you're estimating based on the number of people you've been able to test?
Yes, you can do genetic modeling, and we've had our epidemiologists at the University of Washington, some of the best in the world, actually look at this. And the situation is we might have 160 people who have been tested that come back presumptively positive. But obviously there are many, many more people who have not been tested yet out there, and the geneticists can estimate that. And the estimates could be actually several-fold more than 1,000. I use that number because it's basically in the ballpark. And the concern about this, and that's why as people who are listening tonight, as communities get hit with this, and they will, unfortunately, because it's a matter of slowing this epidemic at the moment, when you're asked to take action and you say, well, why? There may be only 3 people in my community. The problem is that when you double whatever that number is and you double it every week, these things can explode. And as I've indicated, if it's 1,000 people today, it'll be 64,000 people in week 7 if you just double that number. And so that's why all of us have to be dedicated to making decisions earlier in this epidemic, even when it may not seem overwhelming at the moment. And that's what we're working through right now, making decisions to get ahead of that curve. And I want to compliment the people of my state because they have been extremely cooperative and people have pulled together. They have not been driven by anxiety. They have been driven by science and a recognition that we're all in this together. So I'm actually pleased how our state's pulling together on this right now.
Do you have plans to rapidly increase the amount of testing in Washington state? And do you have the resources to do so if that's the direction you think this ought to be heading?
Yes, we've actually increased our capacity by a factor of 20. We were very fortunate. We made a decision, one of the first states in the country, to develop this testing criteria, and we've been building that capacity. It's gone up by 20 times since the last 2 weeks or so. We also have brought on the University of Washington. They have now capacity of probably over 1,000 a day, and we are bringing on commercial labs, and this is very important. Here's where the federal government is helping and needs to help, to develop commercial labs to be able to have a very rapid throughput so they can do tens of thousands of tests. And we need that eventually as this epidemic increases. So yes, but we are right on the edge right now of having enough testing capability, and we're doing that as quickly as we can. I want to mention something that may be pertinent to people's personal lives as well. If you do happen to develop mild symptoms, and as you had a doctor talking just before I came on, talking about the fortunate effect that probably 80% of the people who get this virus, fortunately, will only have mild symptoms that really won't require any medical intervention. And if you do go to your physician, most of the time, if you have mild symptoms, they may not recommend a test because it really won't vary how you're treated. And you can get the test now. I urge the federal government. They previously had a restriction to prevent people from getting that test if they really, really wanted it, or if their physician wanted to give it. So we were successful. We asked the federal government to remove that restriction, so physicians now can order the test. Talk to your doctor, ask what they're suggesting to you, and follow their advice.
And hope that depending on where you go to the doctor, they've got access to the test to give you if your doctor agrees that you should.
That's correct.